Hurry on. So today we're going to be looking at yoga for pregnancy and birth and the postnatal period. Now this is a really big subject. So this is just an overview of what pregnancy yoga is about, postnatal yoga is about, and basically what to do if you're teaching a regular class and you have a pregnant lady in your class. So as you know, this is a subject which we teach in the ashram for 10 days continuously. So it's really just a glimpse and to give you an idea into what the pregnancy yoga is about. And if we look at what yoga to practice, well, asana is well known and it is the most common thing to practice for a pregnant woman, but there are also lots of other things that she can be doing as well. So there are lots of pranayams, the breathing techniques that she can do with really great benefits. Some of the cleansing techniques she can do, not all of them. We're going to go through all of this in a bit more detail. Meditation, of course, is a great tool. Relaxation, visualization, all amazing. Then the yogic philosophy, which is really, really helpful because if we can give her some guidelines and some help towards having a more positive state of mind. If we can help her to get over any kind of obstacles, any kind of stresses that are occurring, then that is a really great gift. And yogic philosophy is the best way to help with her changing of the mind and to have that positive state of mind. And then we have mantras as well. Many mantras will have a very deep effect, not only on the mother, but also on the baby. So first we'll look at the benefits before conception, because ideally you want the mother and father to be practicing yoga. Of course, a lot of students will come to you when they're pregnant and have never practiced yoga before, which is also a challenge, but you'll have a lot of students that come to you and say, oh, I'm planning to have a baby, so what kind of things should I be doing now? And it's well known that a lot of couples do have problems with conception. Something like 15 to 20% of all couples will go through infertility. So it's really important that both the woman and man are as healthy as possible. And that's on all levels. So here you can see prepares the woman, and I need to put the man in there too, physically, emotionally, and spiritually for conception. It also creates a nice positive environment for the baby to be conceived and grow in. It promotes physical and mental health. It helps to overcome any barriers and fears they might have in preparation for having a child. Here I put the woman, but of course there can also be barriers and fears for the man too. And those fears can also have a strong impact on whether there is a conception or not. So it can be that there is a fear of, for some women it might be a fear of childbirth. They're so scared about childbirth that they don't want to have that child, or they're worried to have a child. It can be about bringing a child into the world, into the environment that we have now. There can be lots of different issues there. It can even be that out of one of them in the couple doesn't feel completely secure with the other. Maybe there's some kind of problem there, so they feel that they don't really want to have that child, though it might not be, they might not understand that at this point. So actually strengthening the relationship between the couple is really important before the conception. Then of course we have things like increasing the prana, vitality, opening energy blockages, and helping the woman and man to develop spiritually so they'll be actually ready to bring that baby into the world. So that's why I say it's not just about the woman, it's just as much about the man. And if they've got a nice, strong relationship, a good understanding of themselves and of each other, then that's definitely going to make it much easier for them to have a family. So looking at the physical benefits, so there are a lot of benefits and I'll just go through them briefly. Strengthening of the abdominal muscles. Okay, because we need to have strong abdominal muscles to support the growing child. You also want to make sure that the back is strong, there is a tendency towards back pain in pregnancy, and also the pelvic floor should be strong. So actually the yoga practices can help to improve the posture, because there is a tendency for many women to kind of walk in this funny way where they're sticking their feet out, kind of like a penguin, they're sticking their belly out, and they can be hunching over as well. So it can help to open up the chest and have the correct angle of the pelvis. So posture is really, really important. As I mentioned, strengthening the pelvic floor, definitely something that is necessary during pregnancy and also postnatally. Then toning all of the muscles that are going to be used in the birth, improving the oxygen levels for the baby, helping the woman gain more control over her respiratory system. So this is helpful, especially during the time of labour. Then we've got smaller things like removal of metabolic wastes, improving fitness, circulation, strengthening of the heart, balancing and regulating the blood pressure. So in pregnancy, it can go both ways. For some women, they may have very high blood pressure, and it can actually become an emergency situation where they need to be hospitalized, and sometimes also have a cesarean. But it can also be very low, and many women, in fact, it's very common to have low blood pressure. So many women can feel dizziness or faintness if their blood pressure dips too much. So yoga can help to balance that. Then we have things like improving the immunity, prevention of back pain or relieving of back pain. And then there's lots of different symptoms that some women can have. Lots of different symptoms can be there for some women. Some women have no problems at all, and other women have a lot of problems from the beginning. So yoga can help with many of those things. So example, fluid retention, leg cramps, varicose veins, constipation. All of those can be relieved or prevented through the practice of. Then increasing the energy levels, calming down the nervous system, creating more space in the pelvic region. So basically, there's not a lot of space for the baby to grow, and asanas can give immediate effects. They can immediately allow the woman to feel more opened up, whether it's in the pelvis or even into the chest. So that's a nice benefit there. Opening the chest, as I mentioned, to create more space. Promoting a natural, healthy birth without intervention and drugs. Now, these days, birth has become a medical procedure, and the rate of cesarean is very, very high in all countries. It varies, of course. In some countries, it's 40%, 30 to 40%, which is on the lower side, unfortunately. It's considered lower. And in other places, it can be up to 90% or even 95%, which is absolutely crazy that it's cesarean or a C-section is considered quite a normal way of giving birth these days. The World Health Organization does not recommend that more than 10% of women have cesarean sections. So it's important for a woman to understand that actually she can give birth naturally. It is a normal process, and there are a lot of techniques that can help her to be able to achieve this without any kind of intervention or without any kind of drugs. So this is a very large subject of labour and birth, but just to know that there are lots of techniques that can be helpful. We'll go into a little bit of that later on. Then prevention of morning sickness, or to help with relieving that morning sickness, to keep the weight gain under control. And here we don't just mean about doing asanas to stop putting weight on, but also to prevent overeating, okay, which can come from many different ways, but often it can be because of stress or anxiety. Then improving balance, stability, and coordination. Now, there is a tendency for a woman to kind of lose that balance, to find balancing positions harder, and to not really understand her body shape because it's changing very fast. So she can knock into the size of the door and stuff like that. But actually, if she's been practicing from the beginning, then she'll be able to achieve many, many balancing positions. And in fact, many women love to do balancing positions in yoga, even in the last couple of months of their pregnancy, because it makes them feel light. Now, I don't mean going and doing handstands and arm balances and stuff like that, but things like the kite pose, the tree pose, even the dancing Shiva pose, dancer's pose, all of those can be really nice balancing positions, and they can be done with the wall as a support. Of course, we shouldn't do any kind of crazy positions where there's any chance that she could be falling, because we don't want to even go there with what could happen. Then, of course, prevention of prolapse, prevention of hemorrhoids, also quite common in pregnancy, and to help with pain management during the time of labour. If we look at the benefits on the emotional and spiritual side, so yoga can help to remove fears, anxieties, conflicts, tensions, and stress. And as I mentioned before, there can be a lot of fears and anxieties that can be there. Any woman who has a tendency towards anxiety, definitely when she becomes pregnant, that's going to be amplified, because there's a lot of things that she could worry about if she chose to. There's a lot of avenues where her mind could go down, and especially with the availability of information so easily. So just, okay, I have this problem, I type it into Google, and oh, maybe I have this, maybe I have that, maybe I have that, and she becomes very, very worried. So yoga can help her to calm her mind and not delve into this panic state or to think that there could be something wrong. Then promotion of relaxation and stress management and emotional well-being. Basically, teaching her how to relax is one of the best gifts that you can give. In fact, not only for the pregnant lady, but for any student. And teaching her how to relax is not going to help her only in pregnancy, it's also going to help her when her baby's born. It's going to help her when her children are growing and later on as well. So it's a very, very helpful technique to teach her. Then to help create that bond and connection between the mother and child. And now there's more research coming out all the time about how important that connection is and how it should be starting while the baby is in the womb. So they found that if the baby and the mother were not very well connected, if the mother didn't have those kind of maternal feelings, then there is a higher tendency towards postnatal depression. And something like 20% of women do go through postnatal depression when their baby's born. So that's a really high percentage. And that postnatal depression can have a very large impact on their life. It can have an impact not only on the relationship they have with their child, but also they have with their partner, with other people, with themselves. And even years and years later, they can still feel that guilt about the feelings they had in that postnatal period. So it's really important that the connection is there starting when she's pregnant. Then changing the quality of the thoughts, because again, a lot of research has come out that if a mother is anxious, a pregnant mother, then there is a high chance that her child is also going to have anxiety. If the mother was going through depression during her pregnancy, then the child may also have that tendency towards depression. So basically everything that the mother is thinking is having an impact on the child. So if she can think in a more positive direction, in turn that's going to have a positive effect on her baby too. Of course, it's not always easy and the emotions can be very, very up and down. So yoga can help to balance that. And of course, you can blame hormones for a large part of that. But also there is the tendency for each individual to some have a more balanced emotions and some do have more extreme. So a lot of yoga practices can help to balance the emotions. Then also to build the mental strength to be able to cope with any kind of problems that might be there during the pregnancy or during the birth. Because there can be things that come up during pregnancy and she needs to be able to deal with that no matter what. And that's going to help her for later on in life too. And then to create those positive feelings of love, compassion, appreciation for what she's going through, what her body is doing, growing that child inside, and having gratitude for the experience. Gratitude just for the fact that she is able to conceive is a big thing. And peace, of course. So that's making sure that we can help and support her through the disruptions and struggles and obstacles that might be coming up during this time. They might be related to pregnancy, but they might also not be. There are a lot of things that she can be concerned about. It might be that she's concerned about her job situation. Is she going to be allowed to continue working there when she's pregnant? When is she going to have to stop? Is there going to be maternity leave? There's lots of things to think about related to that, and money situation. If the pregnancy was planned, of course she might not have as many of these problems coming up, but if it's unplanned, then there's even more to think about. How is her situation where she's living? What about the relationship with her partner? Is it stable? Is it loving? Are there any problems there? So there's lots of things that she can be thinking about, and she may need a bit more support on to help her get through it. Then to help her to build trust and faith in her body, in her body's ability to grow this child for this 9 months, to be able to go through labor and birth in a positive way, and also to be a good parent. To help empower her so she understands that she does have that strength within herself, that she can do it. To honor the time of pregnancy, because it's a very short time. That 9 months in one's life is very, very short, and it's amazing what the body goes through in growing that child. So she should honor and respect what her body is doing. And then improving concentration, clearness, because for some women things can become a little bit fuzzy during pregnancy because their body is so busy growing a child. So there are practices that will help that. And the last point here, creating that yogic awareness so a woman can birth in a conscious and powerful manner, because birth does have a very, very strong impact on the mother-to-be. Now looking at the postnatal benefits, so of course yoga can help to tone the abdominal muscles, get everything back into shape, help with weight loss, bring the uterus back into its correct position and of course shape. But more importantly, it helps to prevent postnatal depression. And even if there isn't postnatal depression, there can definitely be ups and downs. So mental health is the biggest factor, the biggest benefit, improving of mental health that yoga can give. Balancing the emotions, improving the overall well-being and fast recovery. So there's a lot of benefits for a lady to be practicing postnatally. And there also has to be some benefits for the baby. So having a more peaceful atmosphere, a positive energy, so that the baby feels much more secure, the baby feels loved. Also to work on the spiritual development of the baby, and this is something that has been in yoga for a long, long time, and it's there traditionally in India that both the mother and father should work on themselves as much as they can beforehand, because this is going to in turn have an effect on their child. So actually looking at prenatal yoga, it's actually a really, really big subject. It's not just about doing a couple of asanas, but there's a whole philosophy about it too, in that we want to invite that positive soul into the world. We want to have a child that's going to be able to cope with the different events of life, and a child that's going to be able to bring something positive to society instead of bringing it down. So, of course, we've got other things like improving blood circulation, removal of metabolic waste, improving nutrition, and the last one, a peaceful delivery for the baby, because it's not only about the mother when she's giving birth. The effects of the birth are also going to be felt with the baby. Whether it's a natural birth, whether it's a cesarean, whether there are interventions, other types of interventions there, all of this has an imprint on the child. And there's so much research now to support that the effect of the birth on both the mother and the child, which can even be felt years and years later. So looking at the most important things to remember, if you have a pregnant lady coming to your regular class, you need to know what kind of poses she can be doing. So looking at this point here, no compression, strain or overstretching of the belly. So if you've got an asana that is going to be doing any of those things, then she'll need to take a variation or do another pose. So this is one of the most important points to remember when you've got that lady in your class. Next, making sure that yoga is practiced with the baby's safety in mind. Because if you Google prenatal yoga, all sorts of crazy things will come up. You'll see like a woman in the 9th month doing handstand scorpion. You'll see all kinds of inversions. You'll see lots of crazy stuff. And this is done without any thought on what's going on for the baby inside. And the thing is, you never know for sure what is happening. There aren't any studies that prove that, no, we shouldn't do a handstand during pregnancy, because what woman wants to go through that experiment if it's going to have a negative impact or a possible negative impact on their child? So a lot of the principles to follow for a pregnant lady come just out of logic and basically to understand what is happening as the baby is growing. Like, you don't know if the cord, if there's a very long cord, if it's starting to wrap around the neck, you can't know that. So it's important that all of the asanas we do are going to be safe, are going to be comfortable, and nothing is going to be extreme. So that moves to the next point, that yoga should not be practiced in the same way or just for the benefits of the woman. Now, honestly, if I think of doing a handstand scorpion, to me that is just boosting of the ego for that pregnant lady. So she can say, look at me, I'm in my last trimester and I can still do all these things. Now, she doesn't really need to prove a point to anybody. And what would be more helpful for her is if she actually practices the asanas that are going to be helping her body, if she has that respect for what her body is doing in growing this child, and if she's loving her body for that. And actually, many of my students who are yoga teachers who have gone through pregnancy, they say that that time of pregnancy is one where they really became more humble and started to actually love and respect their body more than they had at any other time with their yoga practice. So it is definitely a time to be very gentle and very respectful for the body. There are so many things that we can be doing during the pregnancy. And the other point to think of is that it's only 9 months out of one's whole life. So 9 months of not doing a certain pose is not going to change anything for our yoga practice. Sometimes people say, oh, but if I don't do this pose during my pregnancy, then I'm going to lose it and I won't be able to do it again. Now, it doesn't work that way. If we decide that we're not going to do a pose for a while, maybe we've had an injury and we can't do a certain pose, once we've healed from that injury, we can again practice that pose. And maybe it takes a little bit of practice, but we will definitely be able to achieve that position again. So the same thing goes with going through pregnancy. If we were doing handstands before we became pregnant, we will definitely be able to do it again. The body remembers how to do it, but we just need to give the body some time. And I think the other thing that happens during pregnancy is we stop thinking of asana as the only aspect. So all those advanced poses or crazy poses that we might have liked doing before, we're just not as interested in them anymore. And the time of pregnancy is the time where one can work on themselves and have much deeper effects than they can at any other time. It's actually this very similar to the time during menstruation for women. So if she starts to work on herself, with different types of yogic practices, she'll start to have much more understanding of herself, any problems she has, any suppressions, anything. Everything starts to come out and she can develop herself much more intensely. If she does meditation, she can delve into that meditation a lot more strongly than she could before she was pregnant. So that 9 months is definitely a time to work on oneself in a much deeper manner. So that can be done through Asana, of course, is one part, but then we've got the pranayam, the meditation, all those additional things that can help. So we'll look into more specific. So looking at the asanas, we want to be creating more space and more openness of the body. We don't want to be closing the body up. So we've already talked about opening the pelvis, opening the chest. All of the asanas should be comfortable. And we know that anyway, in yoga, it should always be comfortable. But for pregnancy, every woman feels it a little bit differently. For some women, certain poses will feel very good for them and other poses won't, whereas a woman next to them might feel it in an opposite way. So it's important that the woman listens to her body, and remembering it's not just about the individual woman, it's also about the individual pregnancy. So one woman might have had her first pregnancy and she loved doing asanas. It made her feel very good. Second pregnancy, she wasn't very interested in asanas. She wanted to do pranayam and meditation, and asanas didn't feel as suitable for her at that time, and that's okay too. Then the next point is about relaxin. So relaxin is released from the placenta, and it is released there. Basically, it's there to help open everything up. So it helps to open up the pelvis in preparation for the birth. Now, sometimes too much is released, and this can also create instability in the pelvis. But what we need to remember is that because the relaxin is being released, the pregnant lady can have more flexibility than she normally does. So that's another reason why we don't need to focus on doing all these crazy asanas, because we won't lose that flexibility because of the relaxin. But what can happen is that, say I couldn't touch my toes in forward bend. Now I'm pregnant and I can touch my toes quite easily, so I can be quite excited about it, and I might go a little bit too deep, which can create that overstretching or some kind of injury. So we do need to take care that we are listening to our body. Now, next, looking at the twists. So we want to avoid any strong twists. So here I'm talking about closed twists, so where our belly is going to be getting compressed. Instead of doing those stronger twists, we can do open ones. So example, if I'm doing Ardha Matsyendrasana, the half spinal twist in the class, so I'm hugging my thigh towards my belly and I'm looking over my shoulder. So instead what I can do is twist the opposite way so that my belly is going to be open and I won't have that compression there, but I'm still getting a nice twist into my spine. So often there are variations that we can take so that we can have a nice twist in our spine without having compression. The next point is avoiding abdominal contractions. So we do actually need to strengthen the abdomen, but we don't need to have very strong abdominal contractions. So we can have them gentle. So for example, we might not want to do two-leg raise pose or Tanpadasana, because when we're doing it, we can feel it, our belly contracts, we might have our legs shaking, that's too strong, but we might have one leg raise pose instead. We might do a one leg rotation, but we don't want to do two leg rotation. Okay, so some abdominal contraction is definitely necessary, but we don't want the super strong core work. Then we want to avoid strong back bends, because if we do a strong back bend, that's going to have a very strong stretch on our belly as well. And the other reason is that in pregnancy, generally the lower back starts to curve more. And because of that curving, it's not necessary that we curve it even more than that because we're already doing a back bend. So actually the forward bends can be more beneficial, or the alternating between the forward and the back bend, like we do in the cat pose. Otherwise, gentle back bends are good. Then we want to avoid prone positions from second trimester. So basically from 3 months is usually when most women's belly may start to protrude from in the pelvis. Of course, every woman is different. Some women at 3 months you can see that they're definitely pregnant, and some women at 6 months you still don't know they're pregnant. So every woman carries differently. But basically when the belly is starting to protrude, that's when we want to avoid any kind of prone position asanas. Then the next point, avoiding lying on the back from the second trimester. Here I mean the middle of the second trimester, if it feels uncomfortable or causes any kind of dizziness. So basically when we are laying on our back, the pressure is being put onto one of our main veins, bringing the blood back from the lower extremities. So when that pressure is being put onto it, it can make us feel nauseous or dizzy, or we just don't feel quite comfortable. So every woman is different again. Some women from 20 weeks, they can feel very uncomfortable laying on their back. Some women in their last month still feel fine to lay on their back. So what we do in the class is instead of laying on the back, allow them to lay on their side, or they may lay with their back at a 45-degree angle. So there's lots of ways that you can modify practices. Then the next point is avoiding inversions. Now this can be controversial. Again, you go on Google, you'll see lots of pregnant ladies doing headstand, shoulder stand, all these kind of things. But there are lots of reasons why we might want to avoid it. One is that it can increase nausea and that vomiting effect. It can increase acidity. Okay, and a lot of women do have acidity, especially later on. Nausea definitely in the first trimester more. Then it can increase the blood pressure, which we've also talked can be a problem. Then it can stretch the ligaments around the uterus, which are already being compromised to maintain the position of the baby there. Then also it can well, basically when we're doing an inversion, we're moving the prana upwards, so we're moving it towards the head. But if we are pregnant, we don't really want to move that prana from in the pelvis. We want the prana to stay with the baby. So that's a couple of the reasons why we avoid the inversions. Now, we can do gentle inversions. We can do things like downward dog if we feel comfortable and she doesn't have any problems. We can do things like Ardha Chakrasana, the half wheel pose. We can do some kind of supported versions. Like if we want to do a very supported Viparit Karni against the wall with a bolster, we can do that. But the other positions, things like the shoulder stand or the headstand, we also need to use our core a lot to maintain that position. And we also don't know what is getting pressed. So it can be that that main vein can also be pressed when we are in that upside down position. And that can mean that you don't know if the blood supply to the baby is getting cut off, basically. So we don't want anything like that to be happening for any of our pregnant ladies. So another option for inversions is bringing the bottom to the ground, on the ground close to the wall, and putting the legs up the wall. And there's lots of options for that too. So there's plenty of things that can still be done. Also things like standing forward bend, even Ugrasana from standing position can be done. The next point here is avoiding holding positions for extended periods of time. So these positions I'm talking about are strenuous positions, strong positions. So for example, things like Virasana, the warrior, Trikonasana, the triangle. Now definitely she can practice these in pregnancy, but she's not going to do them for like a minute or 2 minutes or longer than that. If she's doing a nice relaxing position, then she can definitely hold it for a longer period of time, no problem. If she's in a child's pose with her knees apart and maybe she's got a bolster or something underneath her chest, but she's got space for the belly, she can stay there for 5 minutes. Fine, no problem. It's good for her. Yeah, so it's important to know that we shouldn't practice any of those poses that are creating strain on the body. And the last point here, care should be taken when moving from supine to sitting, standing, and so on, because many times if the blood pressure is low and we move very fast, it can make us feel very dizzy, okay, in pregnancy. Sometimes it can create nausea as well. And the other thing is when you're moving, you also need to take care of the belly. So for example, if I'm laying on my back and I want to come up to sitting, now normally I would come up onto my elbows and then come up to sitting, but because of pregnancy, we roll onto the side and then we come up to sitting. So we have to do things in a slightly different way, and we have to do things slowly. Now looking at some asanas. Now there's a lot of different kinds of asanas that can be done in pregnancy, and you can refer to my pre and postnatal yoga handbook for that. But just to give you some examples of some poses that are nice to do. So we've got certain asanas that are classically used in pregnancy. So things like Supta Vajrasana. So this is the thunderbolt pose where we lay on our back or we lay at a 45-degree angle. We've got Supta Titlayasana, the butterfly pose in supine position, but actually the butterfly pose can be used in all sorts of ways. So when we're in a sitting position, we can do it on the ground in supine. We can have the legs also against the wall in a butterfly. So there's lots of different options for the butterfly position. Then we have Shashankasana, the child's pose, so with the knees apart, so the space is there for the belly, is a really nice one. In fact, probably one of the most favorite positions for pregnant ladies. Then there's lots of different versions of squatting positions. The horse pose is one of those, but there's lots of other variations too. We've got simple Ugrasana, so this is just sitting position with the legs wide apart, just to help increase the opening of the pelvis. And Majrasana, the cat pose, that's another favorite for ladies. Then we have open spinal twists, open gentle forward bends. So example, you might do Ardha Paschimottanasana, the half forward bend, and you know, for some pregnant ladies, they can do it for the whole 9 months, but for some, the belly might get a bit large. So instead of bending towards the direction of the leg, we can reach towards the ankle or the foot, but we can twist the body a little bit so that we're not going to have any kind of compression of the belly. So we're kind of looking upward. So there's lots of variations you can take for classic asanas to help in the class. And then simple standing poses. So a lot of the standing poses can be really good for strengthening of the legs. And this is a good preparation for labour and also preparation postnatally when the mother may spend a lot of time walking around, rocking on her legs. So it's really good to do those standing positions as well. And I haven't added in here, but definitely balancing asanas. We want to be doing a couple of balancing asanas in the class, remembering that we can have a chair or the wall as a support as well. And the last point, the joint freeing movements, Pawan Muktasana Series 1. So this is just all the movements of the joints, and that's always going to be very helpful in a pregnancy class. Then looking at pranayam, so just learning how to breathe deeply is so important and so helpful. So putting that in, you might have some ratios, you might teach the ratios, or you might just get them to breathe deeply. Then Anulom Vilom or Nadi Shuddhi, so the alternate nostril breathing is very helpful for balancing of the emotions especially. Then we have Brahmari, the hummingbee breath. So those vibrations are also going to be felt by the baby and can be very helpful for anxiety, stress, insomnia, many other benefits too. Ujjayi is very good for anxiety and to relax the body and mind very, very quickly. And the Shitali and Sitkari, the cooling breath, is good for morning sickness. It's also good for any kind of heating issue. If there's, say, heartburn, acidity, if she's having hot flushes, also has a very relaxing effect. So those are some of the pranayams that we can be doing. Then looking at cleansing techniques, so Vamandoti is recommended in the first trimester if she has morning sickness and if she's vomiting. If she's never done Vaman before and she just has nausea, then the cooling breath is probably going to be sufficient. But if she is vomiting, then Vamandoti is going to be a very, very helpful technique for her to do. Because basically when we're vomiting, in pregnancy, you know, all the acid, everything is coming up, food, if there's any in there, it's coming up. And it's very, very different to doing Vamandoti, where we're drinking salt water and vomiting that up. Because first, there's not going to be any acid. Everything is very, very diluted, and we're doing it on an empty stomach. So when we do Vaman, it actually helps to reset that acid in the stomach, and it can prevent that acidity from increasing again, which creates that nausea and vomiting effect. So if she is having that morning sickness very regularly, if she's vomiting quite a bit, then if she starts doing Vaman every morning for a couple of days, then she can get that under control. So it's actually a really, really helpful technique. Neti, of course, can be done. And it's not specifically for pregnant ladies, but for some women, they do have this postnasal drip during pregnancy. So this is where there's just like a drip at the back of the throat. So neti will help with that. Lagu Shankar Prakshalan, the partial cleanse, can be used for constipation if necessary. If she doesn't have very strong constipation, then there's other options that she can be using. And if she is going to do the partial cleanse, then it needs to be changed slightly. And the last one is tratak. So concentrated gazing, whether it's on a flame or a dot or the sun or moon at particular times. This can help to improve the concentration and the focus, and it will definitely give the relaxation benefits too. Then looking at meditation and relaxation, so we've got Yoga Nidra. So definitely a specific Yoga Nidra for pregnancy is going to be so helpful. Then lots of different kinds of meditation are going to be beneficial. If she has a particular meditation practice, she can continue with that. Otherwise, there's lots of other options that she can do. She can also visualize a healthy pregnancy and a healthy birth. She can even visualize how the childbirth is going to be. So especially if she does have a fear of childbirth, then we can put that visualization into a meditation or a yoga nidra. Also visualizing the connection between the baby. And I like to do a shavasana laying on the side. So relaxing all the body parts and then putting in a short visualization can be really, really lovely. It might be a visualization about honoring all that the body is going through, which is also nice. So there's lots of different techniques that we can use. Then looking at mantras. So again, lots of different mantras are there, but Om is a very famous one, and there's a lot of benefits from the chanting of Om, and there's a lot of studies supporting this. If we chant Om, definitely, well, any mantra, the baby will also feel those vibrations. And if Om was making the mother feel calm and relaxed, which of course it does, it also in turn will make that baby feel more relaxed. The other thing I hadn't mentioned earlier is if the mother is very, very stressed, she's going to be releasing those stress hormones into her blood, and that's of course going to circulate to the baby. So it is important that she is as relaxed as possible. Now the mantras is something that might be done not by the mother, it could be done by the father or somebody else, and it's a nice way for them to connect with the baby. So whoever is doing them, it will definitely have a nice effect on everybody around. Mahamrityunjay mantra is also a very good one for healing. So if there's any kind of health issues, and also just to help deal with any kind of obstacles that one is facing. And the Gayatri mantra is used for increasing energy, and also it's traditionally known to be practiced for intelligence of the baby. And it's often practiced even before conception. It's recommended that the man chant the Gayatri mantra for this same purpose. And of course, there are other types of mantras that can be used too, but these are the common ones. And we have Mudras and Bandhas too. So Mula Bandha, the contraction here of the cervix, is what we're aiming for. And basically, we're contracting all of the pelvic floor muscles. And this is very helpful in pregnancy to strengthen those muscles, but it's also really important to learn not only how to contract, but also how to relax, because at the time of birth, you don't want the muscles to be just in that contracted state. You want them to be able to loosen and relax. So both things are very important, and it's important in pregnancy and then postnatally too. We've got lots of different hand mudras. So Yoni mudra is one of the hand mudras that we can be doing. There's a few versions of Yoni mudra. Prana mudra is another hand mudra we can be doing. And also prana invocation mudra is another nice practice to do, which helps us to get more in touch with our prana and be able to direct our prana to a particular area, to our baby. Then having a positive resolve can be really, really helpful to overcome any kinds of fears or anxieties or stresses that are there. They can help to increase positivity and faith. And there's lots of different resolves one can have, but basically having a resolve of a healthy body, a healthy baby, and a healthy birth are going to be very helpful. I like to give some resolves to my pregnant ladies, and I ask them to put the things on the wall, basically to help build their mental strength so that they realize how powerful they are. They realize that they need to respect what their body is going through and also their mind, and they know that they have that power within them and that they can be positive and be happy. So having that resolve will definitely be of great value. And of course, we want to try to avoid negative thinking in situations as much as is possible, remembering that life is always full of ups and downs. We can't always be thinking positively, but there's always a positive perspective on almost everything. So if we can start to see things from a different view, then we can start to see the positivity in life in many aspects. So that is very helpful, but it is important to not make your students feel stressed if they do have a negative thought, because it is still natural that negative thoughts may come up, but we're just trying to have more positive than negative. Then looking at labour and birth. So as I've mentioned previously, there are many positions that can be helpful for a woman during the time of labour and during the time of the birth. And now we all know, we've all seen, pictures or in the movies of a lady laying down on the hospital bed, screaming in pain. Now, laying down on our backs on the bed is the most painful position possible during labour. And it is a position that is there basically only for doctors to see what's going on. It does not help the woman in any way. And now there's a lot of research and awareness about moving the body in different ways to encourage the labour to improve and to be able to deal with the pain. So starting to get off the bed, moving around, whether it's walking, whether it's swaying, whether it's different types of yoga poses, whether it's walking up and down stairs, there's lots of things that can help with getting baby to move downwards. And there's a lot of positions that are there also for the time of the birth. So not all babies are born in the same position. And we also know from history previously, until this last 100 or 200 years, babies were always born in an upright position, and they're generally born in a squatting position. So many positions that we do in yoga can actually be used for giving birth to babies. So that's where yoga has really a lot of value. Of course, we've got other techniques that can be helpful too. All the types of breathing techniques can be really good. Teaching her how to relax, teaching her how to breathe slowly and calmly will be very, very helpful. Chanting, whether it's chanting of Om or different sounds of Om like A, U and Ma, can be helpful. Visualization, here I've put visualization of a flower opening, can be used. Visualizing the baby moving downward. Here I'm talking about the birthing breath, so that's where we inhale and we exhale and visualize our breath moving down and out. So there's lots of other techniques on top of all of these which can help with having a more natural birth. Now, the common problems, I've already mentioned quite a lot of this, so you can just look at that list very quickly and you can see what are the common problems, and definitely yoga can be helpful for all of these, and it can definitely prevent a lot of these problems from occurring. Now, looking at postnatal yoga, so when can we actually start yoga? Many people say, when do we have to stop yoga? And actually, now you can see so far from this lecture is that basically we can be doing yoga for the whole pregnancy. We can do yoga when we're in labor. We can give birth in a yoga pose, and we can immediately start doing yoga. What yoga changes? If we just think of doing something like Surya Namaskar, well, we can't just go and have a baby and do our 20 Surya Namaskar. We definitely have to adapt, but there are always things that we can be doing. Now, as soon as our baby is born, there are things that we can do. We can do meditation, we can do yoga nidra, we can do simple breathing. All of that is definitely fine to do from early on. Asana is another story. That's going to take a little bit more time to build up with. And when to start that will definitely depend on how the birth was. Here you can see the point about Mula Bandha. We can do the Mula Bandha basically as soon as the birth is over, if she thinks about it. Now, when to start for the other practices? Now, usually we say 6 weeks. So starting gentle yoga practices from 6 weeks after birth if there were no complications. And then she can do regular yoga from 3 months. Of course, this will depend, as I mentioned, on the birth. If there were was there any tearing, any stitches? She needs to get checked by her doctor or her midwife so that they can say that, yes, it's now okay for you to start your yoga practice. Now, she could have been doing a few other things before the 6 weeks, things like, arm movements, and shoulder movements, neck movements, ankle movements, basically movements that aren't going to be affecting the pelvic floor or the lower abdomen are fine for her to be doing. Just things to gently warm up and loosen the body. Now, if she's had a cesarean, she needs to wait at least 8 weeks before she starts the gentle yoga practices, and normal yoga can be done from 6 months onwards. Now you might think, wow, that's such a difference, and it is, because a cesarean is abdominal surgery. You have to cut through so many layers to get to the baby, and you'll see that having a cesarean, it's recommended that you're not driving for 6 weeks just because of that pressure of your foot against the pedal in the car. So it is important to allow the body to heal, because the outer stitches in a cesarean, the ones of the skin, they heal very fast, but those internal stitches, they take a lot longer. And, I've actually known of a few people who have started doing things too early, not just yoga practices, but just everything physical too fast, and it split the stitches internally. They've had infections. It's awful. And no new mother wants to have to go through that. So it is important that she does give herself time to heal. And then she slowly starts incorporating different yoga practices and builds up over a period of time. The other important thing to mention here in postnatal is that for some women, they will have split abdominal muscles and they don't know it. So they think, oh, my belly's still big even though I've had my baby. So I need to start doing all this yoga and I need to do exercise and I need to make my belly flat. But if they've got abdominal separation and they start doing all this strong exercise, certain exercises can actually make it worse. So things like sit-ups, crunches, all of that will exacerbate the problem instead of healing it. So it is important to know what kind of things should be done postnatally and also to know if that separation is going to be there. So just looking at a couple of the asanas that we do postnatally. So this, of course, will depend on the lady and what's been going on for her. But basically, we'll want to strengthen the belly, the back, tone the uterus. So things like the cat pose, we might do the Virasana variation, so the one leg, one arm lifting up in cat. We can do leg movements. The plank position we can build up to over a period of time, though that's not recommended if there are split abdominal muscles. Downward dog we can be doing. And this is from six weeks onwards, because the other thing to remember is that in those first couple of weeks after birth, there is going to be bleeding that's occurring. So that needs to be over before you can do things like downward dog. Then closed twists. So instead of the open twists we were doing, we're going to be closing up. And same with the pelvis. We want to have pelvic closing asanas. We don't want more pelvic opening because we've had enough of that in the last 9 months. And then we want chest opening asanas because they're going to help bring a little bit more balance to the body, because there is going to be a tendency to hunch over. Hunching over because of breastfeeding baby, but also just from holding baby, rocking baby. It can create quite a lot of tension in the chest and in the upper back and in the neck and shoulders. So there are lots of nice movements we can do to open up there. We can do some gentle back bends. We can do Gomukhasana, the cow face pose. We've got the right angle pose. There's lots of different arm and shoulder movements. So all of those things are great postnatally. But most important are things like Yoga Nidra and Pranayam and meditation and deep relaxation, because those are the things that are really necessary during that postnatal time when she's not getting a lot of sleep. She's dealing with a lot of things that she hasn't had to deal with before. You know, babies are not always easy, and especially for a new mother, she'll definitely have a lot of struggles going on. So the other thing is having that support from the group, from the teacher, that will definitely help her on her journey. So this is just an overview of pre and postnatal yoga and what you can be doing for your pregnant ladies that come in your class, or any woman who comes back to the class postnatally. Hari Om.